Irby, and I work for a company called Premise Healthcare that is employed by BWXT, and we're going to get into all of that in a little bit. It's my hope today that as we're talking about industrial and health rehab, that you really kind of get a different perspective on it. Because like I kind of said before, if I had seen this topic as a student and had the choice to go to it, I probably would have been like, yuck, boring, I don't want to go see that, lecture. Because in my mind, industrial rehab is teaching people to do box lifts all day long, right, as a student. So I'm hoping I can give you a different perspective because it's really changed, the climate of healthcare has changed the way industrial rehab is presented, and hopefully I'll get you guys excited a little bit about it today. For starters, I'm going to give you a little bit of my background and how I got into physical therapy. So to start off, I went to undergrad at Virginia Tech. So yes, I'm a Hokie, always do. I started as a pre-vet major and very quickly realized that I was not as into large animal science as some of my Blacksburg counterparts. In short, I don't like cows that much, so we switched majors really quick, went into the pre-med field, and at the time I was also running track at Virginia Tech and cross country and was so excited about the biomechanics of everything, they're so into how you change your posture and your arms and your hips do this and that, that I knew I had a passion for biomechanics, but really didn't know where to place that. So I started digging more into the medical field and shadowing different people, and I fell in with this great physical therapist who was so excited and kind of, had that same love for mechanics that I did, the biomechanics, and the rest is history. I just kind of was hooked from then on out. Afterwards, I went to MCV at VCU in Richmond. When I applied, they were a master's of physical therapy program. We got there my first week, and the director sat us down and said, oh, by the way, you have 6 more months of school, and you're going to graduate with your doctorate. Surprise, which was very exciting. And, you would think that was like 30 years ago, but I graduated 12 years ago now, and I was one of the first, if not the first, in Virginia doctorate of physical therapy program. So that alone should tell you how fast evolving our profession is really becoming. During that time, I still had that love of biomechanics, but really didn't know what to do about it. So when I graduated, I did what a lot of people did in that time, and I hope you guys won't have to because you have such diverse clinicals. But my first job was very much a mix, where I took a job at Augusta Medical Center in Fishersville, Virginia, and saw a little bit of acute care, ortho outpatient, neuro, aquatic rehab, just a little bit of everything. And in that setting, we had a neuro specialist. And so I learned really quickly, I don't like neuro. It's not that I'm bad at it. It's just that I love to see people progress. I love to see that change over time. And again, I have such a passion for the mechanics of everything that as I'm treating the neuro patients, what I kind of felt myself drawn to were fitting people with AFOs or changing their gait pattern or doing things like that. And so that led me to Lynchburg, Virginia, where I took a job with Rehab Associates. Worked for 5 years with a guy named Josh Bailey. I don't know if you guys have heard from him. Yeah. So he is kind of a foot and ankle specialist, biomechanist, definitely a specialist and a guru in that area, and loved it. Spent 5 years making orthotics and teaching people how to walk well and all that jazz. Well, at the time I had a newborn daughter. When she turned a year old, I decided to step away from just the high pace, high hours, and took a job at BWXT with Premise Health, where it was my pleasure to actually be part of the startup team to start up this new PT service on site and kind of build it from the ground up. And what it's evolved into now is so different from what we started with. It's been just really exciting to be a part of it. So we'll kind of go through all that. So for starters, let's talk a little bit about, like I mentioned, this evolution of industrial rehab and why we even have this in the first place. And it really kind of all started when you looked at the cost that companies were spending on workers' compensation, right? They realized that injured workers cost them a lot of money, especially if they were injured on the job. And it was more than just that. If you had chronically injured workers, not only were they not working, but their overall the culture of the company was really depressed. Like, you didn't have happy workers. It wasn't a nice place to work. Didn't get a good reputation. And so they started implementing different forms of industrial rehab to shift the focus from being reactive, where they had an injury that they were trying to fix, to be more proactive, where they were looking ahead saying, all right, how can we prevent injuries? What are some things that can help the culture of the company and kind of boost morale and boost overall health and wellness? And that's where industrial rehab was kind of born. So some of the benefits that you're going to see from the employer standpoint from industrial rehab is that it is a lower cost. So when your workers are healthier, they're more productive, and they're not going to be, filing claims or lawsuits against the company. So overall, you're going to see that there's a lower cost to have healthier workers. You're going to have improved productivity, and again, that whole culture of having a happy worker who thinks, oh, my employer is taking care of me, they're invested in me, they really want me to stay healthy and happy is a good thing. And from the employee side of things, there's always this sense that people think, well, this person wants to be a workers' comp patient, or they want to be injured or whatever. It's not like that at all. Most people, when they are injured, their short-term disability is bringing in less income than if they were there working as a healthy worker. So the shift has kind of shifted from, when you look from the employee standpoint, most of them would say they would rather be healthy and working and bringing in that income and having the choice to do overtime than they would being at home relying on short-term disability. And again, that overall quality of life, work environment. And also I want to point out, I put these pictures up here for a very specific reason, because it used to be back when industrial rehab started, you were seeing mostly manual labor workers, right? Again, box lift people. The ones that are going to have the repetitive chronic injuries. But probably now, when you look at the workforce, 60 to 80% of your workers are what I call desk jockeys. They're sitting behind a desk most of the time, and their injuries are going to be very different from someone who's a manual labor worker. And then the one that always gets forgotten about is security officers, police force, firefighters, just anybody who's going to be like active military. Those are the ones you don't think about as being part of industrial rehab, but can be a huge component of that. So, Premise Health. I always cringe when people ask me where I work because it seems so complicated. It's not really, but my employer, the person who pays my paycheck every month, is Premise Health. And who is Premise Health? Well, they are a nationwide company who goes into other companies and starts up health and wellness services. So, in short, they are medical providers on site, and they're with some really big name companies. You might have heard of like IBM, Disney, Notre Dame, Scott's Mulch and Fertilizer, right? All of those guys have Premise Health on site providing some form of health and wellness services. Now, the services that they provide are really going to depend on the workplace. Disney may have a completely different set of healthcare services than we do here at Lynchburg, just depending on what the employer wants and what the employees need. It's really going to shift and depend on what the needs of that environment are. The cool part, though, is that the goal of this company is actually to improve patient engagement in their healthcare. So no, they're not just trying to go in there and provide services. They actually want the patients to feel invested in their own health and to take ownership of keeping themselves healthy and safe and having that whole sense of health and wellness. They're just there to provide more convenient services so that the patient can do that for themselves. And that really is their ultimate goal. And so they want to deliver high-value programs that are going to improve overall health outcomes. Not because they're forcing it on you, but because they're making it so the employee will choose it for themselves. And that's really key, is getting the patient buy-in, or client buy-in in this case. So Premise Health is who employs me, but we are contracted by BWXT. How many of you guys are from Lynchburg? Raise your hand. So you may have heard, of BWXT, right? So if you know anything about this company, it is a high security area, which means don't ask me any questions because I really can't answer many about it because I don't know what I'm supposed to know, not supposed to know. All of the things on this slide are taken directly from their website. But basically, BWXT supplies nuclear components to both the government and to some commercial industries. We know it has to do with the Navy, and they have different processes. But the very cool part is that recently in the news it was released that BWXT is actually developing nuclear propulsion technology, thermal propulsion technology, to power the spaceship to Mars. So I can say I'm working for NASA now, right? Yeah. Now our Lynchburg facility, there are facilities across the country, some in Ohio, some in, I think, Tennessee, right? Where is it? Just Ohio?
Just River, Ohio.
Yeah, me too. So the Lynchburg facility here, we have over 2,000 employees. The last count, it was like 2,200 on site. There are machinists, you've got your engineers, technicians, security officers, and administrative staff. It's a little under 500 acres. It has more than 1 mile of security fencing and barriers, and it has about 870,000 square feet under roof. So translation is when you drive on site, you're going through security, you park your car, you walk, you go through security, and a lot of people have over a mile walk to get from their car to their workstation. So we're talking like a really active population in that sense, which we'll get into that. So what does Premise Health with BWXT look like when you put the two together? Well, we have our own brand of on-site services. Like I mentioned before, other companies are going to have different services just depending on what they need. For us, we have a section of the plant that is secure. That means you need top-level government clearance to get into it. And the only two services that are in that area are your medical doctor, nurses, dietitian, wellness staff, and we have one PT who can go in the secure part. But the rest of us, PT and personal trainers, we are housed inside a fitness facility that is not secure, but you still need a level of clearance to be able to get into that site. So the medical doctor and nursing staff, they provide both episodic care. So if somebody has a heart attack on site, they're right there. They actually have their own rescue squad right there on site too, so that they can like transport them out quickly and not have to worry, again, getting through security to get someone off site. It's a really big concern. They also have routine visits, so flu vaccines, blood pressure monitoring. We do primary care wellness there now, so you can name that doctor on site, who's Dr. Meadows, as our primary care physician. There's also a nurse practitioner and a variety of different nurses as well. There's a dietitian and a wellness coach, which obviously the dietitian is going to work with, changing diet, lifestyle changes. The wellness coach is actually pretty cool. What she does, she happens to be the dietitian right now, but there are two separate jobs. She just has two. But what she actually does is she develops programs that try to get people interested in improving their health. So one that I can think of right off the top of my head is the holiday holdout. So during Thanksgiving time, they'll have a weigh-in before Thanksgiving. And if you gain less than 5 pounds between the start and after Thanksgiving, then you're entered in for, say, a free iPad or a gift certificate or something like that in drawing, which is kind of cool. But they have other programs too. They even did cooking classes one year where they were like teaching people how to cook healthy meals. They took a group that were interested to the grocery store and taught them how to read food labels. So they're very interactive and creative in trying to help people make good decisions. So that's all inside the secure facility. Outside of the fitness center, we have like this huge facility with free weights, machines, cardio. We have a huge multi-purpose exercise room with TRX straps and kettlebells and you name it. They have classes there for yoga, body pump, all these different classes that they offer as well. And that is where our physical therapy services are. So physical therapy, we do focus a lot on preventative care. We have programs, and it's not uncommon to have somebody come in asking, hey, I got this twinge in my back. How do I prevent this from getting to be injured? That is a thing that we do. But a lot of it too is we are treating active injuries, post-surgical care, and it's largely orthopedic in nature. And obviously our number one goal is to return to their prior activity level. And we're also able to provide the ergonomic corrections. That one PT I named that can go into the secure part, the reason she does that is because it's so top secret. A lot of times you don't really know what the person's workstation setup looks like unless you can be there. So she's able to go in, order the right equipment that they need to kind of set things up and make it better for whatever injury that we're treating at the time, which is cool. So why do they choose this on-site health service? Well, it's super convenient. So like we talked about, if you have to park your car and go through security and walk a mile to get to your desk, we're talking like 15 minutes of travel time just to get through security and get on and get situated. Now our site is 30 minutes from the closest PT center. So you're talking about a 45-minute commute from desk to PT, plus the hour treatment in PT, and then to get back. So it's about an hour and a half turnaround time where you're just traveling in your car. And that is a huge barrier for most people for getting physical therapy or even getting like their flu shot or their primary care wellness visits each year. That's a big barrier for them. So there on site, if somebody needs their flu shot, because the medical doctor is right there inside the secure, they can walk 2 minutes, get their shot, go back to work, no time lost, and they're healthier for it. Or if they need PT, they still have to walk to their car, but at least it's only that 15 to 20 minutes to get to their PT appointment versus the 45-minute commute to get back and forth, which is cool. It's a lower cost, and we talked about that from a company-wide perspective, but from a patient perspective, because BWXT is self-insured, they're able to pay our contracts directly, and that relays to lower costs for the patients. So from my standpoint, it means I don't have to deal with insurance. We document and file as though we were filing to insurance, so we can track the costs that would have incurred, but we aren't having to deal directly with insurance in terms of, well, if they don't cover ultrasound, we can't do ultrasound, or if they don't do another service, we can't do that. And to the patient, that means that the only thing they're responsible for is their copay, and that was set up by the company itself. So low deductible patients are paying $10 a visit, high $20 a visit. So even the high deductibles, which would normally be $50 a visit, are only paying $20 a visit, and that's really beneficial for them. With our current insurance plan, to go to an outside facility, it costs between $80 and $120 a visit for PT until you meet your out-of-pocket deductible, and that's why it's such a big deal. So the other advantage too, like we talked about, we have all these services on site, right? You've got your dietitian, your doctors, your nurses. Well, it is so cool when I get that patient that walks in with back pain who also happens to have a blood pressure problem or diabetes, because, all right, I've got this person for back pain, but while we're treating them and they're getting better, we're also talking about their diabetes. And that can relay into a conversation where, hey, you know, Susan over here is a dietitian. You really should talk to her about healthy eating and what are some choices to kind of get you back on track. Or if they're having a hard time managing their blood sugar, you can refer them to the nurse practitioner or the doctor to follow up. And the really cool part is we have this great relationship with our personal trainers. So our patients, when they start to get better, and they're maybe 80% pain-free, 90%, and they're trying to get back into their prior level of function, we have a really close working relationship with our personal trainers where we can say, all right, you're ready, but you're not quite ready, so let's let you train with the trainers for a couple of weeks. We'll recheck you, and then maybe you'll be ready to return your sport or your activity and kind of bridge that gap between 80% better to 100% without keeping them in therapy 2 or 3 times a week for an extended period of time. We really do see, we don't see chronic pain patients, not very often. A lot of patients, when they are injured, they're way more likely to come to our clinic within the first 2 weeks to probably 2 to 6 weeks, if not 2 days in some cases, which leads to a lower length of therapy. So I love it when you get that call and said, like, the 10-miler, right, was last weekend, and wouldn't you know, we had like 5 calls that week, like, hey, I think I pulled my hamstring, oh, I think I tore my calf, and so we had 5 new patients, all 10-miler related, but how cool is it that we're able to capture them the week after, or a couple days after the race, as opposed to waiting, you know, 6 weeks, 6 months where they're limping, have a chronic problem, and it's going to take 3 times as long to fix. So because we get our patients during the acute phase, we find that their recovery time is much faster and they get back to full function as opposed to having residual deficits that take longer to recover through. So on site, again, security, that's always the barrier with bringing outside providers in. So because we're right there on site, we're able to provide a lot more preventative care programs. So we do pre-hire security screens. Our security staff, we take them through a litany of tests and movements that they will have to perform on their job duties. And we're monitoring their blood pressure and their heart rate, and we're kind of watching to see if they're going to be safe to perform their job. And Jamie can tell you that is just so fun to do. I never thought I'd enjoy it, but it is a blast to take them through this test. You know, you have them crawling on the ground with their gun, and you're watching their heart rate to make sure it's not getting over, you know, whatever the limit is. And, but that, again, we're trying to decrease the risk of injury to our security force. We also started a shoe fit clinic about 5 years ago. They had a mandatory switch where workers were required to wear composite shoes, and for a lot of people that was a cause for problems. Well, the first year we were in business, our PT clinic opened, we noticed a lot of my patients that were coming through didn't really have foot pain, they just had questions about their shoes. And so I said, I could have answered this in 10 minutes. We don't need an hour visit for this. So we developed a Shoe Fit Clinic where it's basically a couple hours where every 10 minutes you just have people sign up to come in. You're measuring their feet with a Brannick device. You're looking at their shoes. It's a good way to screen them for any potential problems, you know, ankle flexibility and things like that, and just educate them on the right shoes that are there to wear. And I think we've seen a huge decrease in foot and ankle cases because of that, at least that aren't shoe related, which is kind of cool. Oh yeah, the lunch and learn opportunities. So there's this great lunch and learn program where they'll periodically have everybody during lunch, they'll ask them to come down and they're going to talk on a specific topic. So it might be about like stretching to prevent injuries, or it might be like how to eat right on the go, dining out. And it's a great opportunity that they don't have to take time away from work. They're just coming during their lunch break. They eat while they're learning from the wellness coach or one of the trainers, and you get a lot out of that. So the other thing too that I noticed from working at Rehab Associates to here is we have very little no-shows, if ever. I mean, the no-show rate is extremely low. Patients will almost always call and cancel. Being on site like that, I think it's just, they feel like it's part of their job to show up for therapy. And so there's very few cases that we have people just not show up for their therapy. Usually they're going to call ahead, and they almost always follow through to the completion, either because their buddies are egging them on saying, oh man, you're still limping, why aren't you going to therapy today? Or they just, again, they feel like it's part of their job, it's part of their culture, and they tend to follow through a lot better. So what does a typical PT patient look like there? Well, we don't treat spouses, dependents, or retirees. So we're talking about the work age, the workforce age. So between the ages of 21 to 65, I'd say most patients are actually right around the 40-year-old mark. That's probably, most of them are guys, although we've seen a ton of women in the last few years that they know were there. I think the first year I could count on one hand how many women we saw. It was very low. We've seen a lot more in the last few years. Orthopedic, acute injuries. So you've got your desk jockeys, you've got your security guards, and you've got your repetitive use postural issues. And again, there's this huge preventative care component. Because we're right there in the fitness center, if they see us sitting down documenting, they're just going to pop in and say, oh my gosh, look at my arm. Is this okay? Do I need to do something about this? And we'll be like, no, actually, you need to wear your biceps, and we need to do something about that. So there is like this preventative care aspect to it, though, where if they feel just a little twinge, they feel like they can just come right in and get like a mini consult to say, do I need therapy or not? And we can either direct them to the trainers or kind of just do something right then and there to kind of get them going. And we have more recently started using the FMS. Are you guys familiar with functional movement screen? Yeah. So our personal trainers have been using it for years, and we loved it. So we decided as a PT group to go ahead and get trained in it as well. And the reason is when we're transitioning someone from rehab into functional movement, it's a really handy tool to be able to say, hey, you're lacking shoulder mobility. So we're going to talk to Sam, and Sam knows what I mean when I say you're lacking shoulder mobility, and he knows the exercises to implement. And so it's just a really nice way to keep us all in the same vein, moving patients along faster, where we're all speaking the same language. And I found it's really, really helpful, again, at preventing other injuries. You treat the shoulder problem, but if you're not screening thoracic mobility with the shoulder mobility test, then is it just going to come back again later on down the road? So that's really fun to implement. And our personal trainers now have gotten to a point where if we have a couple of low back patients that they're seeing, they'll actually put them in a group section where they'll have 3 to 5 people doing like a low back training session as a group. So they're watching for form, they're instructing them in different exercises, and they're kind of progressing them at the same pace. And again, it creates that culture of, okay, I'm not alone, we're all doing this together, and this is good, this is fun, we're going to do this. So take-home message from all of this, like you're thinking, wow, this is great, but you've got a doctor, a nurse, a dietitian, you've got all these resources at their fingertips to use. And you're right, it is kind of easier for me to kind of grab each piece and piece it together. But my challenge to you is that as you're out in the workforce, whether you're in orthopedics or acute care or you're dealing with different workers, is that you start to think more holistically, where you really are trying to find a dietitian, at least one, if not a couple, that you can work with in your community to kind of be able to refer back and forth to. Or because of direct access, You know, we're the ones seeing the patients first. Well, if you spot a blood pressure issue on someone, just reach out to their named PCP and start that dialogue, because if we're referring to the doctors, they're going to refer right back to us, and we can create kind of that loop where we're all thinking more holistically and preventatively. Don't forget the ergonomics of the work environment as you're treating either. And in my job, a lot of times they can't tell me what they do, but I can say, well, how do you do whatever you do, you know? Just show me, do you do this, do you do that? Like, just show me what you're doing so I can help you retrain and make sure that you're moving well enough to do your job. And then the other aspect too is see if you can incorporate exercises throughout the day that are going to offset whatever injury that they're having in their work environment. The patients I treat are hilarious. They're like, you think we have all day long to do these exercises? I said, nope, but I know you have a minute every hour. If you can just plan it out and do one thing every hour, it'll make you better. But when you're treating the very stationary desk jockey type people, then you have to kind of get them up and moving and out of those postures to combat what sedentary work habits will do. And then always try to link arms with some trainers or some people in your community that will help you transition. Most patients are going to stop therapy when they're 80% better in a normal orthopedic group, and it's because they can't afford to go longer, and they're not going to justify it, because they'll say, I'm pain-free, you know, I'm doing most of what I can do, I can get the rest on my own. So if you're able to find a few trainers in your area that you're comfortable with working with, that'll be really handy in getting them from that 80% to 100% improved and not get re-injured into your clinic. So that's the dreams. I didn't ask her ahead of time though. That is Sally Sullivan Travely and Michelle Deans in the back. Obviously you guys know Jamie. That's just a little bit. We have a few that are missing out of there. That's our awesome team. We miss Jamie, but we're glad she's here. That is about it. Any questions?
So this past summer, I worked in the urgent care, primarily workers' comp population, and a problem that we came across was if we're trying to refer for more visits, we didn't immediately call it, like, hop on it at visit 4 instead of the last visit. So we had to kind of call the adjuster and get the approval process starting sooner.
Yeah.
Because we had people who had a 2-week delay, so they actually came back worse. Because you're so in-house, do you kind of avoid that problem because they're right there, or do you still have that type of, I guess, same system that we may have had?
It's really interesting. We don't treat hardly any workers' comp. You would be so surprised. I mean, we were looking back, I think we might average 2 or 3 workers' comp patients a year.
Gotcha.
And the reason is they are focused on safety and accuracy. So where some plants, they just want you to box 50 boxes in 30 minutes, but they don't care about quantity. They're looking at quality, accuracy. They want to make sure all the systems are in place. And so the injuries we'll see on site will be like somebody missed a step and broke their ankle. It's not anything that's as prevalent. Yeah. I don't know. We haven't had as many issues though with the ones we've treated, and it is because we're so closely linked with the doctor, going back and forth on the phone and just talking to him. But yeah.
So you have open, free access to treat things that might have happened at work, but also things that might have happened at home as well. So
yep.
There's no, and I wonder if that kind of cuts down on the number of workers' comp situations, because, you know, who knows when it started, and a lot of times,
yes,
you know, they do something at work, and well, then that turns into a comp case, but it's almost like you can work around that because they can come to see you guys. Can they come direct access in the same way? They don't have to go to the physician first and then to you guys?
Yep, they can come direct access. We're all direct access certified, and we encourage it, and that gives us dialogue to kind of talk back and forth with their PCP. And it's cool because they're so acute when we get them. A lot of times we don't really even need the referral because they're done within 3 to 4 weeks. So they are done within that time frame, which I liked. Yeah, it is. Sometimes it's ambiguous, like, you know, they've got this back issue, but maybe it got a little irritated at work, but it got better, and then again. So yeah, it can sometimes be a little gray, kind of trying to name whether it is or isn't. But a lot of times the managers are very, like, they think someone's hurting. They're like, all right, did this happen at work? What's going on? You know, they want people to get help as quickly as possible and not be injured on the job if they can. And that's the other cool part too, is that, you know, a lot of places it might be really hard to get away from work to get help, but the managers, most of them, it just depends on who your manager is, but they will allow you that hour of time and flexibility to be able to get away to do your therapy. Not all, but most. Especially if we give them a call.
How many patients do you see in a typical day?
We try to keep it to one patient an hour. If it's something like an orthotics visit that I'm just checking, I'll do a 30-minute just kind of recheck. We're kind of a one-stop shop, meaning we are receptionist, secretary, billing, we're kind of everything. So we have it was Jamie for 5 years, one person who helps us, so Jamie, come back. One person who helps us and does like everything else, answers the phones and schedules and collects copays. So if that one person's gone, we do everything. We have to be able to know how to do it all. And then we're all PTs, no PT assistants yet. And our space is so small, we can have 2 therapists there at one time, but if we're seeing more than one patient an hour, it gets too congested. We just can't. We start running into people, and it's nice. It's really nice.
Have you found any disadvantages or challenges with this system?
Well, funny you should mention that. Yes. So Premise Health, who I love, they're an national company, big company. So the only issue we've had is getting students onboarded. There's a reason why we don't take students, and it's because there's a 1-month onboarding process to get students on our site. So our contract has been bought out. So as of January 1, we actually will be contracted by the Physicians Treatment Center here in town, which I'm actually happy about because it may actually mean we have clinical rotations. Because we wanted it for years, but our Premise Health would not allow it. Security reasons, they said.
But that was more from premise, not BWXT.
No, BWXT is totally, because to get to the fitness center, you need like a background check and drug testing and a couple other things, but it's not as secure, so you are able to kind of get onboarded pretty quickly. But Premise Health, I guess because of security of the patient's information, you've got all this training to do, and it's been a nightmare trying to get people onboarded. So yeah, that's hopefully next year, because we wanted students for 3 years now, and just every year it's been, no, not yet. Oh, and the other disadvantage, I don't get to treat kids. I miss my teenage population and my really old people. But, yeah. Any more questions? Well, feel free to look up on the websites, premishealth.com or .org, one of those. We'll have more information. And they also post job openings too, if you're looking at whether Disney has it. Or Notre Dame, Yeah. It's fun. Yeah. All right, cool. I told you to keep me up. Let's get back to that. There she is. Oh, thank you.
Thank you so much for having us.
Thank you.
Oh, yeah.
I saw the topic. I'm like, I'm not sure if I would have gone to that as a PTA. I'm thinking repetitive box lifts. What is that?
I did for the third year review.
Good luck to you.